We're going to be talking about the link between multiple sclerosis and malaria. And there is over 100 years of evidence that is linking multiple sclerosis with malaria, that malaria could be and likely is one of the main infections that causes multiple sclerosis. So, today we're going to take a little bit of a deeper dive into some of this evidence because it's really profound. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed over 35 years ago with multiple sclerosis, and by the grace of God, I learned early on that MS is an infectious disease. It is caused by a parasitic infestation. I didn't know exactly which parasites were involved at that time, but over the years, we have learned a lot. We've coached hundreds of students from all over the world in the Live Disease Free plan. We have built a proven plan that has helped me to stay MS free for over 35 years now and has helped hundreds of people around the world. But we're still learning more and more about these specific infections that cause multiple sclerosis, but also other chronic diseases. It is so shocking. I'm going to give this to you just before we start, but why are we not carrying on with this research? Those are the kind of the questions that I want you to think about when I share all this information with you. Why is it that, like, what happened? Why did things change? Why are we now solely focused on immune suppression? We're no longer carrying on with all of these pioneers that have spent, like, there's over 75 studies linking MS with malaria. And I'm not saying that malaria is the only infection. We know that's dysbiosis. We know we're dealing with a few infections, but it looks like malaria could be one of the major players, or a protist similar to malaria. Just like Borrelia is a bacteria that is similar to syphilis, and neurosyphilis causes a lot of MS symptoms too. So we're going to just talk about malaria today. And I was going to talk about, I will tell you like treatment at the end, but we're going to spend more time on symptoms and blood work and treatment, because as we really flesh out these major players in multiple sclerosis and other neurological diseases, it really helps our practitioners to be able to treat us more effectively and to have more evidence, because they have to follow standard of care. And if they don't follow standard of care, depending on the country they live in, they could risk losing their license. But if they have a lot of evidence that their patient is dealing with specific infections, then they can use their professional autonomy to be able to help their patients. So this is really the goal of the work that we do at Live Disease Free, is to really help educate us that are dealing with chronic disease so that we can talk to our doctors. And if you don't have a practitioner that will help you treat these parasites, make sure to reach out to us. I'll share at the end how we help people to recover, because a lot of people are having a hard time finding doctors at this point. So if you follow my work, you know that MS is an infectious disease. It is caused by parasites, and a parasite is any microorganism that lives in the body and causes us harm. And so there can be a lot of different types of parasites, but today we're just going to talk about it's called a protozoa. So there's worms, there's bacteria, there's protists or protozoa, and there's fungi. And today we're going to talk about one specific type of protozoa, and it's Plasmodium, and it's malaria. And it's just crazy, all the evidence. Like, I had to cut it off because I don't want to make these videos too long, and I want to stay focused on certain topics. So again, malaria is a protozoa, and it's spread through mosquitoes. So we can get it through mosquitoes. And normally we would think of malaria as something from another country like Africa, that we wouldn't have malaria in our countries, in North America, et cetera, or even in Europe. But that's not the case. And actually, there were outbreaks in the 20s and 30s in the US, and probably in Canada too. I'm just digging up more and more. I had no idea. But so basically today what we're going to do is look at the history of these amazing hero researchers years ago that were really pulling up some really important research linking MS and malaria. So their hypothesis in this one study, and so this is part 4 of a series. If you want to look, I did one video, and it's a blog post on our website, livediseasefree.com, talking about how a malaria drug helped PPMS, so primary progressive. I think it's primary progressive, but it's progressive multiple sclerosis. So there's not a lot of therapies that will help progressive multiple sclerosis, and they found that hydroxychloroquine actually significantly helped. And probably the dosages that they're giving is not a high enough dosage. We'll talk a little bit about the treatments. We'll talk more about that in a future video. But what they found is that it actually made a difference. It did help, significantly helped people with primary progressive. So you guys can go and if you go to my blog post on livediseasefree.com, you can read my notes quickly. You can listen to the shorter version of the video, or you can just do a Google search of Live Disease Free and hydroxychloroquine or malaria drug helps MS. So that was a study I talked about. Then I did 2 other blog posts. So those are like articles. And on those, I talked about these 2 really well done studies where they're more like reviews, where they looked at so many different authors, like neuropathologists, people that have been studying all of these infections. And so their hypothesis is that an infection of malaria in early childhood, which normally is a silent form, so apparently, and I haven't looked a lot into this yet, but apparently for children, that for a lot of kids, that if they get malaria early on as a child, it's more of a silent form. They don't get really, really sick. Maybe some will if they have more, again, the dysbiosis, their microbes are out of balance, they're immune suppressed. But for a lot, it's more like a silent form. And that'll give them immunity to malaria. So if they get malaria, but they don't really have a lot of symptoms, and then they have immunity to the malaria, that prevents the development of multiple sclerosis later on in life. But if people get an infection of malaria, even if it's the silent form, so maybe they are bitten by a mosquito, they're exposed to malaria through usually mosquitoes, at the age of adolescence or adulthood, that could cause multiple sclerosis. And I know that that's, you might be thinking, well, how do they think that? Well, they bring a lot of evidence forward. So today we're going to just talk about some of the scientific findings, but then we can also talk about the geographical location differences, for malaria and multiple sclerosis. Today we're going to just talk about some of the findings that they've had with respect to the similarities between malaria and multiple sclerosis. So could malaria cause multiple sclerosis? In 1892, there were 2 researchers. Most of these researchers are neuropathologists. And they wrote a paper on the clinical picture under which multiple sclerosis coincides with malaria, how that could be observed. They distinguished between 3 forms in which MS so this was back in 1892. So these were 2 researchers. They published a paper where they were kind of looking at the clinical picture of MS, and they were kind of linking that or comparing it to malaria. And so they felt that there were a lot of similarities, and they distinguished between 3 forms in which MS had been seen to accompany, so to be at the same time as malaria. So in the first situation is where symptoms are transitory, so they're coming and going, only present during an attack of malarial fever. So if somebody had a malarial fever, they could show symptoms of multiple sclerosis. Or symptoms appear after the fever and are very, very duration. So after the fever, they can have MS-like symptoms. And then the third situation is where symptoms appear suddenly, but there's no fever. And for people that have malaria, so the person has malaria and they don't get a fever, but they get these neurological MS-like symptoms. And that's more if it's in the larva stage of the malaria. So remember, there's an immature form stage of different parasites, and the larva would be that stage. In 1897, the researcher, his name is Spiller, He wrote, "The case of malaria I have to report was one with the symptom complex of disseminated sclerosis." So disseminated sclerosis is basically multiple sclerosis, because disseminated means it's spreading and sclerosis is hardening of tissue, like that's what we have with MS. So whether it's spreading or we have multiple, it's the same thing. So he had a case of malaria that he reported was one with a symptom complex of this disseminated sclerosis, which is the same thing as MS, largely unilateral, so on one side of the body, which we see in multiple sclerosis. Usually it's our left side or other. So it's affecting one side of the body. And he had the opportunity to observe the patient quite frequently and recognize the resemblance of that case to somebody with multiple sclerosis. So he had a malaria patient, and he was quite shocked at how similar the symptoms were to malaria. In 1899, and I share this on my masterclass training, there's a researcher, Manneberg, was probably the first researcher to really believe that multiple sclerosis could be caused by an infection of malarial parasites. According to him, a symptom complex resembling MS, so basically the group of symptoms resembling MS, plays a role in malaria. The symptoms are very, very similar. In 1900, this same researcher published a paper of a case of malaria presenting the symptoms of disseminated sclerosis. And in this case study, a patient who suffered for 8 years with multiple sclerosis, he had no history of malaria, and he had never shown any malarial attacks. So this is like how it can be a silent infection. So this person had MS for 8 years, and he tested positive for malaria. I believe when he died, they discovered it upon his death. So when he died, they were able to look at his remains, and they found he was infected with malaria. And so he had MS for 8 years, and interesting. That was in 1900. There's a lot of other case studies. I'm going to bring them to your attention next time, just because I don't want to go too long, because I want to answer your questions also. In 1904, researcher Mueller thought that malaria and MS were caused by blockages of small blood vessels in the brain by parasitized red blood cells. So I forgot to mention too that malaria is a protist. It infects our red blood cells, so it destroys our red blood cells. And we know that through CCSVI, for those of you that don't know, that's where they open up our veins. We know that there is like this vascular disorder with MS. We know that with every lesion, or probably most, if not all lesions, I've heard all lesions from one researcher, that there's always like a vessel, a blood vessel, a small blood vessel around every lesion. And so this researcher in 1904, he thought that malaria and MS were different, but they were both caused by blockages in our small blood vessels in the brain by red blood cells that became, blocked up things because they became parasitized by malaria. So he recommended quinine as a useful remedy in all cases of multiple sclerosis, especially for people that suffered with vertigo symptoms. MS is a form of malaria. Is it a form of malaria? So there were textbooks written in 1936 and in 1963, so in 2 different textbooks. Both described chronic malarial infections causing neurological symptoms which often resembled multiple sclerosis, where the patient did not get a fever. So they did not get a fever, so they wouldn't have known that it was an infection, let alone malaria. And the malarial parasite was very difficult, if not impossible, to detect. And that's another problem, is that it's not like they can just do a blood test on us and they'll find a lot of the malaria in our blood. Maybe they can find antibodies. We'll talk more about that in videos coming up, or events that I do coming up. But from what I have read so far is that when we have these chronic silent infections of malaria that enter the central nervous system, they're very often very difficult to pick up. Maybe they would not be as difficult to pick up if they did, like with the spinal tap, if they were looking for malaria, but they're not looking for malaria. And so very often it's when people die that they discover this. So these textbooks, they were comparing the neurological symptoms of malaria and MS. So one of the symptoms would be scanning speech. So this is where there's a pause after every syllable, and the syllables themselves are pronounced slowly. So there's a real impairment in cognitive function. There's intention tremor. So a tremor gets worse when somebody is reaching out for something specific. So as you're trying to reach out for something, your tremors are getting stronger. And then also a vision condition where the eyes make repetitive, uncontrolled movements. Also spastic gait, which is a stiff, where your muscle becomes really spastic. It's usually the long muscles, a permanent contraction. We can end up with drop foot. And again, on one side of the body. And also increased reflexes. So if you've seen a neurologist, they've probably tapped your reflexes and they've told you if your reflexes are stronger. So those are just some of the common. There's a lot of other symptoms that are really the same with multiple sclerosis, but these are just textbooks back in 1936 and 1963. All right, and then there's something called malaria granulomas. And that is looks like it's present in multiple sclerosis also. So granulomas, they are like tiny clusters of white blood cells and other tissue. They can appear in our lungs, on our skin, different parts of our body, and they form as a reaction to infections. So they're kind of like a little area where your immune system is fighting infection, almost like, think of it like a cyst or something like that, but they might be a little bit harder, I'm not sure. 1917, a researcher, Dirk, he found malaria granulomas in MS patients. He questioned whether multiple sclerosis was caused by malaria because he found these little clusters of white blood cells and tissue in MS patients, and they were caused by malaria. And he thought he figured that these malarial granulomas could be the start of MS lesions and the cause of MS. Then several other researchers also found these granulomas, although their findings have never been confirmed. Like the research stopped. We didn't continue studying this, which is really sad. Then let's talk about capillary hemorrhages. So with multiple sclerosis, when they're looking at lesions, they know that in the center of an MS lesion is a blood vessel, a very small blood vessel. And that's true for all, from what I've heard, all MS lesions are surrounded by a blood vessel. In 1849, a researcher found several hemorrhages. So a capillary is the smallest blood vessel, and that's where a lot of things are transferred between our body and our blood system. So nutrients are going out into our tissue and waste material comes back into the blood. So that's where a lot of the transaction is going on. So those are capillaries, those are the smallest blood vessels. And a hemorrhage means that there's a break in it, right? There's a break in the capillary. So in 1849, this researcher found several hemorrhages in a case of multiple sclerosis. In 1849, that's a long time ago. So these hemorrhages were also observed by a number of other neuropathologists. In 1911, two researchers were convinced that multiple sclerosis was caused by an infectious agent, 1911, and that the formation of lesions were just the result of these little tiny blood vessels that were breaking open, hemorrhaging. In 1916, researcher Dawson also found small hemorrhages or capillary hemorrhages in MS patients. In 1942, two neuropathologists wrote whether the individual lesion is the nature of a hemorrhage, so if it's resulting because of a hemorrhage, or because of tissue death, or a granulomatous nodule. So remember those little pockets of white blood cells that malaria causes. The end result is a patch of sclerosis, what we have in multiple sclerosis. And multiple areas of sclerosis scattered are going to really affect brain function, they said. So the malarial ring hemorrhage, so that's something that's known with malaria, is that there's something, it's called a malarial ring hemorrhage. And in MS, there's something called an iron deposit in MS lesions. And they're very similar. Could they be caused by the same thing? So with Plasmodium, which is the protist that causes malaria, they do infect our red blood cells, which we call erythrocytes. So just call them red blood cells. So they do infect our red blood cells, and they do cause a lot of circulatory disorders. Remember, we know that we have a narrowing of the veins. We know that lesions are always circled around the veins, etc. So in 1988, and this is when I was first diagnosed with multiple sclerosis, researchers, they shared that ring hemorrhages around the obstructed or damaged vessels in the brain tissue were commonly observed when malaria was in the brain. So researchers that were studying malaria, when they found malaria in the brain, they could find these ring hemorrhages, so like a ring type structure in the brain. And in 1982 and 1988, different researchers found iron deposits surrounding the lesions in all MS cases studied. So this is in MS. They're finding iron deposit, so rings of iron. They believe that the ring was evidence of a past hemorrhage. So if our blood vessel that's around the lesion, like if there's a break in the blood vessel, then obviously their red blood cells come out, and we know that our red blood cells carry hemoglobin, they carry iron, so we can end up with this ring. In 1943, when using an iron-stained method, researchers saw deposits of iron directly surrounding the MS lesions while in the lesion. The iron was mostly only a trace, so it depends on how much hemorrhaging happens at the capillary. If there's a lot of hemorrhaging, there's going to be a stronger ring of iron. If there's a smaller amount of blood released, then there's going to be a smaller ring. And small hemorrhages and the perivascular type of demyelination are similar in malaria and multiple sclerosis. So again, I don't know, I can't remember if I mentioned it, but researchers know very well that malaria is a demyelinating disease. That's well known. Malaria causes demyelination in the central nervous system. They know that. Okay, one last thing I think that I want to mention here, or one last similarity. So leptomeningitis in malaria and multiple sclerosis. So they found that in multiple sclerosis and in malaria, there is this condition where, and it's called leptomeningitis, where there are more lymphocytes present and not as much of the monocytes. So those are just different types of immune cells. And remember, with MS treatments, they're trying to suppress our lymphocytes. They're trying to suppress our T and B cells. So researchers noticed that there was a similarity with multiple sclerosis and malaria in that they both had more of the lymphocytes and less monocytes were present. And the part of the brain was also thicker and more opaque in both. So in 1917, Researcher Dirk reported on this condition and in some cases of cerebral malaria. So in MS and in malaria that's in the brain. Only cells resembling lymphocytes and very few monocytes were found. So multiple sclerosis is linked to other species of malaria. So there's just like with Candida, I've shared with you that there's cousins of Candida. There's Candida albicans. There's a number. There's at least 20 or more different types of Candida. Well, it's the same thing with malaria. There's different. Same thing with Lyme disease. There's different species, or I call them cousins. And so because like wherever you live in the world, there can be different species of malaria, just like there's different species or different types of Lyme disease, et cetera. And multiple sclerosis is linked with other species of Plasmodium protis, which cause malaria. So the Plasmodium protis are the parasite, and they cause the disease called malaria. And malaria can produce a wide range of central nervous system symptoms similar to multiple sclerosis. So I have listed some of those on our previous part, maybe it's part 2 and part 3. Take a look at our blog post on livediseasefree.com. Malaria, part 2 and part 3. There's 3 parts. And you'll see that there's so many symptoms that are similar, many more than just those ones I listed from the textbook, neurological symptoms that are very, very similar. So different species of protists that cause malaria that are linked with MS. There's a paper in 1903. There's a paper in 1965, 1981, 1992. And that's where I'm just going to end here with that information. So this is pretty big. Like the more I dig into it, it's just incredible. And so for me, like I've always had, and so this is where I'm going to bring more research to your attention. So because there could be other parasites that can cause neurological symptoms in our central nervous system. But if you've had, your red blood cells, like if you have your blood work done, and your red blood cells are bigger than normal, you have less red blood cells than you should, you have other symptoms of malaria, and to like, why is it that maybe some of us, like I actually went to Africa, like a high school trip when I was 18 or 19. Could I have been bitten there? Could I have been bitten in Canada, right? There's skin rashes that you can have. So you look at a holistic thing of like different physical symptoms, blood work, health history, and for many of us, this could be one, or maybe even Babesia, which is similar to the protist that causes malaria, and they both infect red blood cells, so they can both cause similar symptoms. But I really like looking at the research. It's just quite shocking, like the amount of studies. And what was so crazy is that like every year or two, there's all these studies coming out and studies and people, and then all of a sudden there's this big stop. There's no more research that I can see that's really current looking at malaria and multiple sclerosis. So why did that stop? Well, I don't know if this has anything to do with it or not, but if we look I just wanted to share this with you. In 2001, and this probably was in the works before, but it was released. 2001, the first McDonald criteria was released. And that basically is criteria for every practitioner in developed countries, or probably all countries, how we are going to diagnose and treat multiple sclerosis. And so at that time, they decided to basically just focus on suppressing the immune system. The immune system has gone haywire. We don't know what causes it. We'll probably never figure it out. It's just our stupid immune system has gone haywire. So 2001 is the first start of this McDonald criteria. And since then, it's really slim pickings trying to find studies where they're looking for infection. I've seen University of Calgary. There's a few places where they're looking at dysbiosis, where they're looking at bacteria in the gut. They're possibly looking at viruses. I think that has more to do with wanting to create a vaccine for us. But it's so interesting how you have all of these years of evidence, very compelling evidence, and then you just drop the ball. That doesn't even make any sense. So, like, what happened? Why? Like, this is where we need to start asking our practitioners, and not just our neurologists, because maybe they're not going to listen to us, but our chiropractors, our functional medicine doctors, right? It's like there's over 75 studies. This has been over 125 years linking MS with malaria, with a protozoa that causes malaria. And then why are we not studying this anymore? Like, it causes all the same symptoms. It's, they're finding malaria in MS patients. They're treating MS patients with malaria drugs, having a lot of symptom improvements. Maybe we're not doing it well enough. But why? Why have we dropped the ball? Why is it that, like, in 2024, I want to talk about, finding the cause of MS, and we can't find any research on the different infections that are causing MS. It's just not coming out, really. Like, it's pathetic. It was coming out more 5 years ago than now. All right, I'm going to go to your questions for a moment here. Awesome. Hello. You're so very welcome. I'll give you guys like 5 or 10 minutes here if you have any questions. So, Joanne, what causes gallbladder problems? Parasites. So, the practitioners, the hero doctors that I've studied under, they say that in the center of each gallstone is a parasite, and your body your body builds things to protect, like to isolate parasites. So they might build a cyst to contain infection, a gallstone, etc. So they're pockets of infection. And so that's why, as we're recovering from these parasites, it's really important that we do liver gallbladder flushes also, because the parasites do like to hide in the liver gallbladder region area. So what I think, like looking back on myself, and this is where you guys can reflect on yourself too, is that, I had dysbiosis since I was a little kid. I don't know when possibly the malaria happened or not. Maybe this is something I'd like to look into a little bit more, but I definitely, we were on a lot of antibiotics for things like strep throat and bronchitis and all of those things. But I mean, there were 6 kids and we were all on antibiotics. I was the only one that came down with MS. I was on tetracycline for acne for several months, and that would have been probably in grade 10, 11 type thing. We went to Africa, and we went to Spain and Africa, like a bunch of high school kids with teachers. We went for like a week. Could I have picked up malaria there? Possibly. Could I have picked it up in Canada? Possibly. I don't know. But then for years, my blood work, like my red blood cells are just a little bit off. They're bigger than normal. There's, less of them and the doctor's just like, oh, that's just normal. That's just you. And I'm like, no, I don't think that's right. I don't think that's normal. And then also when I was having babies, I got these little red dots all over my torso. And that can be a sign of malaria also. It can probably be from other microbes too. So like you just start to piece all these things together. And yes, I did have other parasites. Could it be that some of us are more susceptible? Like maybe there is a small amount of malaria infected mosquitoes still in countries. Maybe it's not epidemic, but it's a small amount. And maybe those of us that have been on too many antibiotics, we're more susceptible. Our immune system is compromised because our immune system is dealing with all kinds of other microbes that are out of balance. And then maybe the chronic malaria, the protist moves into the central nervous system and becomes a chronic infection there. But then again, there could be neurosyphilis, there can be other infections too, but it looks like from the mountains of research that are out there, number one, finding this protist in MS, the similarity in symptoms, also treating people with hydroxychloroquine or quinine, all of those similarities together really show like, oh my gosh, there is a huge, huge link. And it's just painful that we are not studying this. Like, literally, what we have to do is we have to come up with a new MS society, and we have to, you can do the runs and the bike tours and things like that, but all that money needs to go to researching which infections are causing MS. And I don't think we need millions of dollars. Dr. Alan McDonald found tremendous information just with on a shoestring budget. So I think that this is intentional, that we're not getting a cure because there's no money in finding a cure. And I don't want to leave you guys hanging. If you suspect, if you look at all of my blog posts linking malaria to MS and you think that that is one of your infections you're dealing with, on the CDC website, they talk about how artesunate is the preferred treatment for malaria. And artesunate is the injectable form of wormwood. It's a type of wormwood, is called sweet Annie artemisinin. And so there's a special pharmaceutical grade that they can inject, and that is the most beneficial for a cure. Again, can you cure this? I don't know. I would think so, but maybe with hydroxychloroquine, probably not. I personally would not just take hydroxychloroquine, because if you look at the study with the primary progressive MS, it's helped a little bit, but do you want to be helped a little bit, or do you want to be helped a lot, right? So if you've had this protist for years, then you probably have fungus, you probably have candida, you could have aspergillus, you probably have some worms, you probably have bad bacteria. And so just by taking a low dose of hydroxychloroquine, as what they would give for lupus or arthritis that manages their disease, right? We don't want to manage our disease. We want to live disease-free. So then you want to treat different types of parasites, but keeping in mind that if you have, the blood work that supports the malaria, the symptoms, exposure, all of that, then you might want to be treating that in a little bit more of an effective way, with maybe finding a practitioner that can do the artesunate injections for that. But I think this is really big for a lot of people, because malaria is known that it will suppress the immune system. And then we're going to be more susceptible to other parasites. You're so welcome. So is hydroxide given for the plaques? I'm not sure what you mean by hydroxide, maybe hydroxychloroquine. So again, if the lesions are caused by a protist like malaria, that causes malaria, and you take like the hydroxychloroquine, but you have to be careful with that drug. Like with all drugs, you have to know the adverse effects, and apparently it can affect your vision. So when you're on that drug, the doctors usually give a smaller dose, and people just stay on it. Like if you have lupus or arthritis, you stay on it for years and years. But again, it's not clearing the infection. So that's why I personally wouldn't just take hydroxychloroquine. If I really felt like I might get energy tested for it, and then if I really felt that I did have malaria, I would, this is where I'll continue to do research and find out, what kind of blood tests are there. Unfortunately, I think that if you do a blood test, you're probably not going to always pick up the antibodies for malaria, and they're not going to see the parasite. It'll be in the central nervous system more so. And so that's going to be a problem with testing. But if you energy test well for hydroxychloroquine, then it might be worthwhile working with a practitioner to get artesunate injection and see if that makes a difference. But just treating malaria is not, especially if you've had MS for a few years, like if you've had it for 5, 10, 15 years, you have multiple different parasites. And if you really want to feel well, then you need to treat all the parasites. And we have students that don't have MS, they have other diseases or other neurological symptoms, and they're infested with bigger worms also. And when they come out, people feel incredibly well. So it's just maybe one out of several that you have to treat, but it could be a really important one for some people. You think you were given it for COVID? Yes. If your doctor prescribed hydroxychloroquine, it was not a standard of care for COVID, but some doctors did prescribe it and also another parasite drug. Okay, last questions here. What are your thoughts on glutathione and ozone therapy? So, ozone therapy is great, but it's really expensive and it has limiting benefits. So if you have lots of money and you want to do ozone, it's fine. But there are other oxygen type therapies, and if you want to learn more about it, you can watch my video, Oxygen Therapy in Treating Parasites, which you'll find on our website, livediseasefree.com, or on Rumble. I can't talk about it here. It's kind of like underground. It gets like, if I talk about it, I can have my videos taken off. So you can find out about it there. And that oxygen therapy is a lot cheaper. You can do a lot more with it. You can dose hourly. You can treat enemas, and you can take it orally, and it's incredible. Everybody should have it in their home and know how to use it. So I have an ozone generator, and I used to use it, but if and when I use oxygen therapies, I just use the other, which I can't say the name of it. Glutathione, your body should make glutathione. So if you are, let me backtrack. I know one student that had glutathione injections, and it's just not going to give you the results that you want. You just have to treat parasites. Your body will make glutathione. I believe that the glyconutrients, which you can find on our website, I believe that that's been shown to help your body produce more glutathione naturally. I'm more that way, that I like, I wouldn't take a hormone, but I would take nutrients so my body could balance the hormones and make the right hormones. I think that's a much safer way to go. You're so incredibly welcome. Life coach medical model, that's awesome. All right, 25. I'm not sure what 25 means, but anyhow, I'm going to let you guys go. So putting it all in perspective is that it looks like malaria, or the protozoa that causes malaria, is one of the infections, one of the main infections that causes multiple sclerosis and possibly other neurological diseases. And in order to recover, it must be treated, but not just the malaria, because if we've had MS, then we've had fungal overgrowth for years, the candida, and then we also likely have had other parasites, worms, etc. And if you really want to feel 20 years younger, if you want to recover, so I'm not talking about taking a parasite drug like, for treating malaria, if you took hydroxychloroquine ongoing and keep getting your eyes checked to make sure that you don't get damage to your eyes. I'm not talking about that. I'm talking about recovering and feeling amazing and extending your quality of life 20 years or more. Getting into, like, I'm in my 60s now, and I want to enjoy my life with my family, with my grandkids and my children, and do things and continue to have memories. So if that's what you want, then you have to treat multiple infections, but you have to understand that this could be one of the infections that's causing a lot of problems. And so if you're just taking worm medications, it's not going to treat this protist. There's specific treatments for specific parasites. And if you have a practitioner that you can share this information with, I would really appreciate you helping us get the word out. Different groups talking about this, right? That's how things are going to change. If enough patients are going to their doctors and saying, hey, do you know about all the research between malaria and MS? And they go, no. Why don't you? There's like over 125 years of research. There's over 75 papers. Why don't you know about that? Right? And if more and more people, they're going to start to feel pressure that they're going, oh my gosh, maybe I should look into this. And that's the only way things are going to change. It's not going to change right now with the system, because it's a very lucrative industrial pharmaceutical complex. And I'm not against pharmaceuticals. It's just that in treating chronic disease, this is not the answer. This is keeping us sick, and we are suffering terribly, and we are dying prematurely. So if you don't have support from a practitioner that knows how to treat parasites, then make sure to watch my masterclass training. I share all the steps we take to treat these parasites, to get out of this state of dysbiosis where we treat worms and protists like malaria and bacteria and fungi. decreasing all the bad microbes, increasing the health promoting microbes while we're building a healthy lifestyle. And that's really how we get our health and our life back. That's really the only way to live disease free. And when we have chronic disease, we found that the herbs are just not enough on their own. I wish they were, but they're not. We will keep trying for sure, but especially for the bigger worms, like we just haven't been able to get rid of them. Like, it's just shocking how infested we are with them when we have immune suppression from things like malaria and other different infections. So watch my masterclass training, and if you want support, we would love to support you in the Live Disease Free plan. There's a lot of students that have had recoveries. You can listen to their successes on our Live Disease Free YouTube channel, but also on our Live Disease Free website. Take some Kleenex because you'll have tears of joy when you hear. And we're coming on at least 8 or 9 years where some of our students have been living disease free. They have been in remission. They have recovered from MS that long ago. And then we have new students that are joining. And we've had so many healthcare professionals that have taken my program. Right now, there's a veterinarian. We just had a couple of other veterinarians and lots of nurses, pharmacists, physiotherapists, chiropractors, even doctors, because our standard of care is not helpful for them to recover. They want to treat the cause. And my hope is that in my lifetime, that there will be a lot of doctors that know how to treat these parasites, and they will be open to it. They will be allowed to do it. That's my hope and prayer. So if you find this research helpful, please help us to get the word out. Please like, share, and subscribe to this channel so you'll hear of the next educational talk that I'm going to do. There will be more on malaria. We're going to go a little bit deeper into, I really want to build a clinical, for people to really go, yeah, it looks like that's one of my problems that I got to talk to my doctor about or get help from us. We'll support you in building a plan, getting the access to the treatments and the practitioners that you need. Otherwise, have a wonderful week, and we will talk to you next week. Take care and bye-bye for now.